So we're going to start out with the layman's terms for bones. In other words, the common terms that we use every day in our common vernacular. And I'm going to give you a couple of lists of those. And I do want you to pay attention to these because they will be relevant to your exam. And then once we finish with the next 2 slides, which will complete the list of layman's terms, we're going to go into combining forms for bones. And we'll kind of jump around the body. We're not really doing this in a super linear fashion. When you learn this in anatomy, usually you start with the cranium and go all the way down to the tips of the toes. And by the way, for those of you on that path, just know that when you take your anatomy bones quiz, you're going to have to name all the bones, all 206 in our body. Sounds complicated, but you have groups of them that kind of help you out, like the carpals, for instance. They usually don't have you list out every individual wrist bone. Ribs don't. A rib is a rib, except for we have. That isn't exactly true. I take it back. There are certain names of certain ribs, but you don't have to name all of them. Okay, so. There's certain things here that kind of group them together. So when you say to name all the bones, you're not going to be listing exactly all 206 because some of them, as I said, are grouped together, like the phalanges. We'll get to that in a moment. Okay, starting at the top of the list, cranium is skull. Clavicle is the collarbone. This thing in the center that your ribs attached to in the front of your body is called the breastbone, or otherwise the sternum. Scapula is shoulder blade. The humerus is the upper arm bone, sometimes called the funny bone. If you've ever broken it, or seen some of the fractures of the humerus I've seen, you'll know there's nothing funny about that. Radius is the lower arm bone on the thumb side. I have a way for you to remember that I'll cover in a little bit. Ulna is the lower arm bone on the pinkie side. The carpus, or the carpals, in their plural form, are the wrist bones. There's 8 in each wrist. Metacarpals are the bones of the hand. There's 5. That's one of those muscle groups. They're not individually named, other than to say metacarpal 1 through metacarpal 2 through metacarpal 5. But that's it. You just have to know they're 2 through 5. So things like that, group them together, make memorizing that 206 bone structure a lot easier. And the last one here, we have phalanges. So fingers or toes, depends on what you're talking about. Once again, like so many things in language, it's contextual. So if we're talking about a hand injury and there's a phalange involved, you can bet it's probably not a toe. Oh, pardon me, the slide didn't change. Let me go ahead and correct that. There we go. Now we have the pelvis, and those are the hip bones. Coccyx is the tailbone that's located all the way at the base of the sacrum, which we talked about earlier. We have the femur is the thigh bone. Patella is the kneecap. Tibia is the shin bone. So it's that big, long, thick lower leg bone you have. The fibula is the smaller leg bone, the one on the kind of on the side that sort of ties things together. Tarsus is kind of like that's the ankle, and it works kind of like the wrist. It's a combination of 7 irregular shaped bones that allow all types of movement. Calcaneus is the heel bone, and the metatarsals are the foot bones. And like the hand, there's 5 of those, and they don't have individual names. They're just known as the metatarsals. They are numbered, however, 1 through 5. Okay, so cranial is the combining form for the cranium, or the skull. Our pertaining to form is cranial, meaning pertaining to the cranium. And craniotomy is an incision through the cranium. So a removal of part of the skull to expose the brain. For instance, you may have a case of encephalitis. So that's inflammation of the brain. The brain is swelling up, and the skull is not going to move to accommodate soft tissue that wants to expand. It's just not going to do that. And of course, brain damage may result from that. So craniotomy might be one way to get around that. And you'll see patients in the hospital sometimes with craniotomies. They literally just remove part of the skull. They use a certain type of instrument to cut a hole. They'll lift that cap out. Usually it's sitting there still adjacent, and of course they can repair them afterwards. But craniotomies can be very important life-saving procedures in order to allow that brain to be able to expand and have a port through which it can go, and then when the inflammation reduces, return back to the inner part of the cranium. The radius, the lower arm bone on the thumb side. So, radial is pertaining to the radius. That's our AL, our pertaining to. A very good way to remember the radius is if you think thumbs up, right? If you like something, you can say, wow, that's really rad, and put your thumbs up. That's rad. And putting your thumb up, and you follow that thumb down to your arm, and that's your radius right there. It's the lower arm bone on the thumb side. So think rad. That's rad. Thumbs up, and then follow that thumb down, that's your radius. That's a really good way to remember that. And if you've ever, once again, going back to the carnivores here, so you vegetarians, I apologize. If you ever eaten chicken wings, you know that when they come in their bone, not the boneless form, there's two sides to it. There's one side that has a single, kind of larger bone, and there's the other side that has two smaller bones that work in conjunction with each other. Very similar to your lower arm and lower leg, I might add. So not a lot of difference between bone structure of the extremities between chickens and humans. Kind of like the same thing in a way. For them, it's the wing. For us, it's the arms and the legs. So that second bone, my point being, is that in the lower arm, you have two bones. One's the radius, the other is the ulna. This is the arm bone on the pinkie side. Ulnar means pertaining to the ulna. So they work in conjunction to provide support and strength and rotational movement, along with the wrist. Same function that the fibula will have in the lower extremity. And when we move just past the radius into more of the hand now, we have the carpus, which are the 8 wrist bones. Carpo is the combining form, and carpal means pertaining to the wrist. Maybe you've heard of something called carpal tunnel syndrome. You have a tunnel that carries nerves down through the lower arm and through the wrist and into the hand, and that tunnel can be compressed by inflammation, displacement of one of the carpal bones, and there's other reasons it may happen, fatigue, overuse, all kinds of things, Parts wear out as we get older. And so that term carpal tunnel is referring to the tunnel that goes through the wrist and causes maybe some inflammation. You will notice here that all 8 bones are listed out, and I do not require that you learn these. When you go to anatomy, you are going to have to learn them. For any of you moving on to rad tech, you are going to have to know them. So I suggest learning them well when you get to anatomy, but I will not require you to learn those. Just beyond the wrist bones, so keep in mind, wrist bones are carpo, right? For the carpals or the carpus. Well, remember the prefix meta means beyond, right? So we put meta on carpo, we have metacarpus. These are the 5 hand bones. Metacarpal means pertaining to the ham bone. So you see that right here. The thumb is on the digit on the far left, and the digit on the far right. The digit on the far left is the 5th digit. So our digits in our hands are always numbered starting with the thumb. So thumb is digit number 1, index fingers digit 2, middle fingers digit 3, ring fingers digit 4, and pinky is digit 5. And so they all have their own metacarpal, and those are encased within the body of your hand. They're not the bones that extend beyond it. And they're metacarpals because they lie beyond the carpals. And that's why I wanted to point that out to you. And they lead to the phalanges or the phalanx. So phalanges is plural, phalanx is singular. Phalango is the combining form. So phalanx is 1 finger or 1 toe. Phalanges, fingers or toes. In other words, the plural form. And phalangeal is pertaining to a finger or toe. So normally we have a predictable amount of fingers and toes in most cases. However, I present to you this photograph, and these are not photoshopped. This is for real. It's called polydactyly. It's having more than the normal number of fingers or toes. So we find this more often on feet than hands. You'll notice these feet here each have 6 toes, not 5. That is real. You can look it up online and see all kinds of pictures that will illustrate polydactyly. We also have it over here on a hand. Now, I probably haven't mentioned this to many of you. Some of you may know that I am a professional musician. I spent most of my early life on the road for a long time. I was on the road for a long time. And I'm a guitar player, and I have 4 fingers and a thumb, and that's what I play with. What I would love to do is be able to see how guitar would be with that additional digit. So the hand they show here it does illustrate polydactyly. However, in most cases, the appendage, the extra finger, is going to be found on one over by the pinky of the hand, is what I mean to say. Usually it's non-functional and very small. It's rare to find 5 functioning fingers along with a thumb. It's a lot more rare than finding 6 toes that are fully functional. So just be aware this is a condition. It is a real thing. And you won't see it very often, but when you do, it's really, really interesting. Okay, so as I told you, we're going to jump all over the place, right? So we kind of just went down the forearm And then we went through the wrists, we covered the fingers, and now we're moving to the ribs, which don't correlate at all, but here we are. Costo is a combining form for ribs. Intercostal means between the ribs, and that's very important because when you place EKG leads, they have to go between the ribs, and other procedures go between ribs, like pneumothoracic, for instance. If we're going in and we're going to, put a puncture in the lung to pull fluid out, then we're going to have to go between ribs. We don't go through the bone. Subcostal means under or below the ribs, and costalgia is a term that means pain in the ribs. So if you were to fracture one, you would have significant costalgia. Then we have the sternum. This is the breastbone. This is sternocostal is a term that refers to the relationship between the breastbone, or the sternum and the ribs. But just to call attention to it, the primary thing we want to think about here is sterno, meaning combining form for sternum. So when we talk about the sternocostal articulation or joints, the sternum is bone, ribs are bone, but the last portion of all the ribs as they approach the sternum are not bone, they're cartilage. So as they wrap around to the back where they intersect with the spine, the ribs are all bone, but as they intersect in the front, they become cartilage as they approach the sternum. And there's a very important reason for that. It allows for expansion and contraction of the thoracic cage, in other words, your chest wall. If they were solid bone connected to the sternum, when you took a deep breath, your chest would not be able to expand. But since we're designed to have cartilage there, and the cartilage connects to the sternum, and then that cartilage branches out, that's what you see depicted, that sort of whitish area here that's moving out from the sternum, that allows expansion and contraction of the thoracic cage, therefore allowing us to be able to take a deep breath when we need to. So you'll often hear the term sternocostal pain. People who have sternocostal pain often think they're having a heart attack because they have a sharp pain going on in their chest. It's very easy to figure out if they're having a heart attack or sternocostal pain, and licensed professionals in medicine will know exactly how to detect that. We also have the pelvis, and I think when we talked about the female anatomy, I pointed out there's two combining forms, and that hasn't changed here. Pelvo or pelvi for pelvis. Pelvic means pertaining to the pelvis. I'm going to call attention to these two diagrams of the pelvic girdle here, male and female. There's an arrow pointing to a certain area, which is called the pubic symphysis, and the ischium is the bone that's coming from underneath that's forming that. Look at the one for the male, and look at the one for a female, and you can see a distinct difference. So when you look at a skeleton, you can actually determine the gender many times by just looking at the way the pelvis is shaped. Female pelvis is going to have, it's going to be wider at the bottom. It's going to be flatter and more round, and this allows for childbirth, so the child can actually pass through that canal. The male pelvis tends to be a little bit deeper and a little bit less wide, and if you notice where that arrow is indicating the pubic symphysis, that V is very narrow there, right? If you look at the female pelvis, it's very wide. So very distinct structural differences between the male and female pelvis. And of course, connected to the pelvis, or, how do I want to say it? They're not really connected, they articulate, I guess, with the pelvis, is the femur. And its combining form is femoro, and it means the thigh bone. This is the longest and strongest long bone in the body. It's very difficult to fracture. If you do fracture it, it's usually quite a process. I've only x-rayed a fractured femur once, and it was quite an affair because there's no movement in the leg and extreme amount of pain. So femoral is the combining form for femur. Femoral means pertaining to the femur. Beneath that, as we move down the leg, we descend, we get to the kneecap. Patella is the medical term for the kneecap, and patello is its combining form. And if we want to speak of it in a pertaining to fashion, we can say patellar, meaning pertaining to the patella. And so that kind of covers that upper part of the lower extremity. And now we're going to drop down below that. We have the tibia, and its combining form is tibio, and this is the shin bone. Those of you who play soccer, this is why you wear shin guards, because it hurts like anything to get hit there because you don't have any padding around that bone. So tibial means pertaining to the tibia, which once again is the shin bone. And like the arm, we have two bones that provide support and structure and allow for rotational movement and maintaining structure and strength in that rotational movement. And this is the fibula. Fibulo is a combining form, and fibular means pertaining to the fibula. then it's this outside bone on the lower extremity. That's 15 minutes. I'll be right back with you in a few